So apparently my last video, my final remarks to TikTok about how ultra-processed food and fast food is really hurting our health as a nation, apparently that was more divisive than I really thought it was going to be. I didn't understand how many people have drank the Kool-Aid and been lied to about how they think the government's regulations are going to fix their health, number one, and the government is responsible for their health in a very granular, specific way. And two, because we've never seen that. We've never seen that. And two, that people think vilifying ultra-processed food and fast food is wrong. Even though I understand that it is the only food source for people that live in food deserts, have lower socioeconomic possibilities. I understand all that. But what this person is saying is that we're unhealthy because we don't have universal health care. Or if you click on it, it says walkable cities. Okay, so I took a whole class last semester in my nurse practitioner program about population health. So let's bring out some data from people that are actually studying this topic. So believe it or not, there are people that study population health. And research shows, this is from the county health rankings. Last semester I did a project on this, essentially. And did you know that only 20% of health outcomes, meaning length of life at the top and quality of life, only 20% is determined by access to care and quality of care. You can see in this infographic here that health behaviors and social and economic factors and the physical environment make up the large majority of factors that contribute to our health outcomes in this country. Just because you have access to care doesn't mean that you are going to be healthy, because our access to care essentially means, in the system that we have in the US, that is far less reimbursed for preventive care, and preventive care is really focused on keeping you not dead. They are not really focused on keeping you optimally healthy. And I know, because I've worked in healthcare for years and years. So we don't have a vested interest really in optimizing your health. What we're trying to do is prevent disease processes or disease states that are already there from getting worse, or manage you symptomatically, manage the pathophysiology that's going on, but not really get to the root cause of it, or work with you to change these other factors, right, to make yourself healthier overall. So only 20% is related to healthcare access. The rest of this is our job. Yes, the government's job, but we really have to take self-accountability. I don't think that you can wait on the government to save you. I think it should have a role, but you are going to live a miserable life and a painful life if you are just waiting for the government to swoop in and change all the regulations and make sure you have healthy food. I understand this is a multidimensional, multifactorial issue, and I do not want to oversimplify it. I understand there are various components like race, ethnic background, education level. Again, I studied all of this last semester, but my goal in my last video was to encourage people to take up their advocacy for their own health and do whatever is necessary to make differences in their health. Maybe they're going to fast food, but instead of the regular Coke, they're doing Diet Coke, or they're opting for water. That's saving money. That doesn't cost more money to switch from soda to water when you go to a fast food restaurant. These are the types of changes we need to embrace, and we need to embrace a whole foods-based lifestyle. Processed food, there are some health foods that are processed. Food is processed. I understand that. I'm not trying to demonize whole foods that are processed. I'm talking about 25 ingredients you can't pronounce that have chemicals and fillers and preservatives and dyes. These things are causing issues in our gut health. They're disrupting our gut health and contributing to autoimmune disease, and it's in the literature. And if you don't believe it, educate yourself. I see so many patients suffer and they're being lied to by these big food companies. And you know, at the end of the day, we're not going to change the food companies, but we need to outsmart them. We need to get smarter, okay? And there's no excuse. Pick up a book, go to a library. There is tons of information out there.